Hello, Board of Directors. I am the nurse Lee Carey. I am presenting to you the AZRMC Diabetic Wound Care Clinic Business Plan. The AZRMC Hospital has insufficient capacity to handle patients with slow healing diabetic wounds, causing a degradation of patient outcomes. This business plan adjusts this challenge to a dedicated AZRMC Diabetic Wound Care Clinic. Diabetic-related wounds are responsible for rapid life quality deterioration among type 2 diabetes patients. AZRMC patient clinics' missions are to increase life outcomes through specialized wound care services that the current healthcare system overlooks. AZRMC clinic offers specialty attention for better outcomes compared to multi-service hospitals. The clinic gauges its contribution to type 2 diabetes patients' life quality through better pain management and reduced amputation cases. AZRMC business plan adjusts type 2 diabetes complications like neuropathy, where citizens lose wound sensations due to nerve distortions, manifest more among middle-aged individuals. The possibility to complication is due to slowing down in physiologic process, leading to slowdown in wound healing. Neuropathy is detrimental as it immunize patients from diabetic wound pains. The neglect risk is high, intensifies the damage. The third mission is to address polypharmacy issues. AZRMC clinic serves patients with decades or a lifelong battling diabetes. They have experience utilizing different prescriptions to sort out health problems. It creates an undesirable situation where drug interaction blunt the efficacy of the type 2 diabetes medications that the patient receives and possibly delay foot ulcer healing. The clinic helps patients with diverse prescriptions to manage their diabetes well. The physicians overemphasize the physical treatment and overlook the mental aspect. AZRMC focus on patients' psychological well-being through consultation. Dealing with diabetes chronic wounds have psychosocial impact on patients. It creates mental distress that affects patients' capacity to comply with physical care specifications. AZRMC clinicians motivate patients on adhering to treatment plans. They address lingering issues like hopelessness and anxiety that compromise recoveries. The clinic's significant advantage is the tailored expertise in addressing patient demographic issues. As individuals age, they experience unique physiological issues like reduction in blood circulation, low immunity, and skin elasticity that complicate foot ulcer management. Another advantage is the comorbidity management for middle-aged individuals. Comorbidity is a scenario where people deal with multiple medical conditions that complicate healing. The third advantage is its focus on psychosocial support through consultative care. It gives patient emotional care to navigate social isolation and anxiety from chronic wounds. The clinic's plan has two significant disadvantages. The first is lack of insurance coverage for some clinic service hampering admission. Non-insurance covers a significant challenge because many patients depend on insurance to sort medical expenses. Out-of-pocket payment is unsustainable for diabetes management. Second one is the overlook of the younger generation. The clinic focuses on middle age to the elderly above 50 years of age. The program overlooks young people requiring tailored diabetic wound care interventions. Diabetic complication impacts individuals from all demographics. The implementation plan for the AZRMC clinic has 4 phases. Phase 1 encompasses background activities before the official launch of the clinic. Significant implementation activities are securing the building space, staff hiring, regulatory compliance, developing clinic guidelines, and marketing. Securing regulatory approvals and license is the next activity before opening. Phase 2 covers the duration between the launch day and the 3rd month. This phase is critical in implementation cycle for data. It generates actionable data points to steer AZRMC operations. Some data points focus on patient admission rates, wound data, treatment modalities, and the running costs. Phase 2 fixates on data collection on refined implementation. It tests critical hypotheses of the planning cycle like running costs, staffing, and visitation to reassess long-run feasibility. Phase 3 focus on data evaluation and implementation requisites change to optimize plan success. The evaluation focus on the discrepancy between the clinic deliverables and expectations. It also requires readjustment to steer business in a good trajectory. For example, if the patient daily data admissions review underperformance, the clinic will launch its corrective action plan like doubling marketing efforts to attract more clients. Phase 4 covers duration month of 9 to 12 months, which handles two significant implementation activities. First is the presentation of AZRMC annual data to stakeholders. First year data is crucial because AZRMC runs on a trial. There is a need to sustainable and existence of the sustainable demand for clinic wound care services. The data answers a series of concerns from stakeholders like operational costs, realizable revenue like and peak and low of patient visitations number. This shapes decision on business model revision or more investment to sort out glaring insufficiencies. Second is the AZRMC performance projection for the subsequent years. The projection leverage first year insights. Over the detailed budget for the wound care clinic. The anticipated revenue for the AZRMC clinic comes from four sources: Medicare, Medi-Cal, self-pay, and private insurance. Medicare will generate $225,250 for the clinic. Contribution which is 53.32% of the total earning. Medi-Cal contributes to $36,180, which is 7.38% of the AZRMC revenue pool. The Medi-Cal patient volumes are low because Medi-Cal target of poor or low income, which explains the low revenue. The clinic also harnesses revenue from self-pay patients. It generates a small earning, which is $19,050, which is 4.51% of the total revenue. The private insurance patients are the second largest revenue earner for the clinic. The projected first year private pay earning for the clinic are $142,100, which is 33.64% of the entire earning. The total anticipated revenue is $622,580. Significant operating expenses for the clinics are wages, medical office supplies, and marketing expenses. A nurse practitioner earns a monthly $9,760. A total cost of a nurse practitioner annually comes out to be $117,480. A two registered nurse hourly pay of $49.90, with two nurses together costing the clinic $207,600 totally. The clinic also requires an office clerk to compensate at $3,283 monthly, translating to $39,395. Employee benefit, including health insurance, disability insurance, dental, vision, and life insurance, retirement planning, and pensions, will cost the company $39,000 annually. The Social Security with 6.2% and Medicare tax of 1.5% will cost the company total of $19,944 together annually. Anticipated building lease will be $40,000 annually and retrofitting of $20,000. Medical supplies cost the clinic $37,800 annually. Office supplies cost the clinic $11,400 for the launching year. Marketing expenses will progressively decline as the clinic familiarity increases. The projected annual promotion cost for the clinic is $25,600 with a significant market expenditure transpiring in the opening months. From the 7th month onward, AZRMC market expenditure will plunge $1,500. The clinic will require professional services like accounting, medical, attorney, electronic medical record cost of $10,850. The AZRMC clinic capital investment is $9,128 for vital equipment, such as including 2 exam tables, 2 vital machines, a Doppler ultrasound machine with a camera. The clinic spends $1,798 on both exam tables. 2 vital machines cost $2,598. The Doppler machine, which is a valuable tool for evaluating extremity blood flow, represents an investment of $3,450. Finally, the clinic will acquire a camera of $1,282, which serves as essential resources for documenting the healing process and identifying the significance of infection or deteriorations. The AZRMC first year used a positive return on investment, the ROI of 22.2%, which is $44,382 that shows in the calculation. The first year financial profit implies a significant market traction for the AZRMC clinic. Other benefits including reduction in the economic burden of diabetic wound management. AZRMC clinic mitigates the economic burden as patients get on-demand wound care services and revert home. It minimizes economic misery for self-pay patients that deplete saving for admission. Decline in admission rates in hospital. The clinic relieves the hospital by minimizing patient wound care visitations. Thirdly, it enhances the life quality benefits patients. The marketing plan is critical to the success of the AZRMC outpatient clinic inpatient flows, nurturing relationship with essential stakeholders and recognition. Marketing spreads awareness of the clinic's outstanding services for patient gain as a new outpatient clinic. The clinic must spend considerable on multi-channel advertising garners traction. The target audience of this marketing is type 2 diabetes patients of over 50 years and older. The demographic is less savvy in social media activity. The plan combines personal outreach, digital marketing through social media and Google, and old school approaches like flyers and posters. The initial marketing plan utilized conventional approaches like social media and posters to promote AZRMC services. The targeted posts on Facebook and Instagram group health groups can amplify awareness. A third pillar of the marketing plan is the optimization of the word of mouth referrals. It entails rendering Super B services to visiting patients and increase the likelihood of visitors' recommendation AZRMC service to needed colleagues. AZRMC is new in the diabetic wound care business. It must work on loyalty for referral marketing to be effective. In conclusion, the AZRMC clinic is an outpatient clinic rendering wound care services to type 2 diabetes patients. It focuses on older patients above 50 years and older, type 2 diabetes complications like foot ulcers that induce hospitalizations. The rationale for the AZRMC clinic is to curb costs for chronic diabetes management and improve quality of life. It aims to mitigate the financial cost of patient hospitalization due to wound care complications. Its service is affordable as patients can operate from home. The clinic aims to bolster patient and quality of life through quicker recoveries. The report adjusts the rollout of clinic with a budget of $200,000. The clinic first year budget has surplus of $44,382, with more gains expected in subsequent years. Thank you so much, Board of Directors. This concludes my AZRMC business plan presentation. This is the reference list. Thank you.